Reduce Inequities and Restore Planetary Health, Part 1. We need to cultivate mindsets for equity and planetary health to design programs for exponential impact. Let's begin with the challenge of the inverse care law. In reality, the people who need the most get the least, and the people who need the least get the most. Now, most parents treat their children equally, but they also use equity to enable each child to reach their fullest potential. Simply stated, equality does not equal equity. Equity is a major mindset shift beyond equality. It's our professional duty to educate people about the meaning of equity and planetary health. Equity assures that people have the right resources and the right care to achieve their highest levels of health, well-being, and human flourishing. Planetary health is about improving our environments to assure equity for all people. Effective leadership addresses the big why question: why link equity to planetary health? Of all the forms of injustices, inequities are the most damaging to our health, well-being, and human flourishing. The demise of planetary health will first affect the poor and vulnerable populations and make the task of achieving equity even more challenging. Equity and planetary health are the guiding civic virtues for striving towards the Sustainable Development Goals. The world's growing population will make striving towards equity even more challenging. This calls for transforming our mindsets from the I mindset to the we mindset. The I mindset serves the individual good, aligns the common good to self-interest, and stops the common good from interfering with self-interest. In contrast, the we mindset serves the common goods, aligns self-interest with the common good, and stops self-interest from working against the common good. This calls for mobilizing organizations and communities to create networks of networks and build peer health movements for equity and planetary health. To generate advocacy power for policy change, we need to develop network power. To link the global health movements, the planetary health communities, and the WHO initiatives, and work for the greater good.